Did you know that in clinics for physical rehab, we use a variation of a yoga pose called child's pose for rehab with low back pain all the time? And it makes sense to use some gentle yoga poses because when it comes to back pain, movement is medicine. And yes, we use this movement even with acute disc herniation. I'm going to teach you how clinically we use child's pose a little differently than your typical yoga teacher might use it. I'll show you how even if you don't have low back pain, you can improve your child's pose in your regular yoga practice and also avoid hip pain. I'll teach you why it's not only safe, but actually beneficial to round your back, even if you have back pain and even if you have a disc herniation. And I'll show you how to use props and blocks and pillows for a more restorative approach, and how we can use tactile feedback from blocks to allow for more support and help to remove some of the fear of movement, especially when you're experiencing acute, very painful low back pain. Generally speaking, child's pose is where we take our hands under our shoulders, our knees under our hips, and then we simply sit the hips back towards the butt as far as you feel comfortable going. But sometimes this can actually cause pinching in the front of the hips and pain in the hips. So let's talk about knee position. You can actually do this on your own. Now this is called a rock back test. You want to find the optimal position for your knees based on how your hips feel. So if you start with narrow knees and you try to rock your hips back and then your back starts to round right away, then that's not going to be a sustainable position for you if you're feeling pinching on the front of the hips. So if you notice with knees together, you try to rock back and you quickly round your spine because of a pinching feeling on the front of your hip, then try taking your knees wider and then getting a nice neutral spine here and sitting back, and you might be able to get a further reach without feeling pinching on the front of your hip. This is because with the knees in, when you try to bring the knees up, there's a little pinching in the front of the hip due to the shape of your bones and your pelvis, or just the sensitivity of the tissues in that area. So if you feel pinching when the knees are in close, then you take the knees out wide, you just have a lot more room for movement in the hip joint. Now let's talk about why we're going to round the spine. Now you might have been taught that if you round your low back, it's bad for your spine. You may have also been told that compression on the front side of the spine causes your discs to herniate backwards like a jelly donut. But actually, research shows that bending your spine or spinal flexion is actually really important to hydrate and nourish the spinal disc. We also have research showing that bending the spine both forward and backward can be helpful in the rehabilitation of low back pain. And this next one's really weird. We even have research that shows when you bend forward that the disc herniation might actually resorb, so it actually might reduce the disc herniation. So in some cases, when you bend forward, instead of kind of squishing the jelly donut backwards, you actually bend forward and suck the jelly back in, if you want to call it a jelly donut. But of course, spinal discs are nothing like jelly donuts. They are very strong. They are tough like rubber. Now in clinic, a lot of doctors will use McKenzie techniques to attempt to find what we call a directional preference. You can try this on your own to see if child's pose is going to be the most beneficial movement for you at home. When people have low back pain, some people find relief when they perform repetitive extension exercises like this. But other people find more relief when they perform repetitive flexion exercises like child's pose. So we could do repetitive rock back. In clinic, what we would do is have somebody repeat each of those movements 10 times and see if the last repetition felt better than the first repetition. Sometimes when they do the extension, like a cobra pose in yoga over and over, they notice that their back pain gets less and less over time, the more they do it. But that if they do the rock backs into child's pose over and over, that it makes it worse over time. Okay, then for that individual, their home exercise would be to perform repetitive cobras because it seems to make their symptoms better. However, for some people, it's the exact opposite. If they perform repetitive flexion exercises, then it actually makes their symptoms better, but repetitive extension tends to aggravate it. So great, they're gonna do child's pose. However, there's a ton of research showing that both repetitive extension or flexion, or generally that motion in both directions is really what's important to hydrate the discs, nourish them, and to alleviate low back pain. Motion is lotion, movement is medicine. So really, in my opinion, I don't think that it has to be one direction or the other. I think that just repetitive movement, slow movement in general, whatever you can tolerate on a given day, do whatever you can. Do as much as you can without pissing it off. Now let's explore how we can use props to provide a supportive tactile feedback and help eliminate fear of movement. You might find that it's simply too painful to get your butt all the way back to your heels, and that's okay. You don't have to go that far. So what you do is slowly move back and just kind of get to your comfort zone and then see if you can go just a little beyond your comfort zone. So it might be a little aggravating, but I promise you, you're not damaging anything by doing this movement. And then you take blocks or a bolster or some pillows or something and basically just prop them right under your butt so that your butt is going to go back and touch the block. And then slowly experiment to make sure you place the blocks at a high enough level that you're not pushing too far past the comfort zone that it's really painful, so that they're high enough that when you get back there and your bum touches the blocks, you feel like, okay, I'm safe, I'm okay, this movement is safe and feels okay for me. And then there's two ways we can explore this, either with repetitive movement, breathe in, and then exhale when you sit back, inhale forward, exhale back, etc., nice and slow. Or we can get an extra pillow here to help us out, and we can just stay here in a restorative yoga pose to really allow the body to relax and accommodate to this position, more so to teach the nervous system that this movement is safe and okay. So if you're performing rock backs, you start at the top and maybe even get a little bit of spinal extension in the mix if it feels okay. Breathe in to start off, and then as you exhale, just go back nice and slow until you feel your bum touch the blocks, and then come back up. The blocks are there sort of like a blanket of security so that you know you're not going to push it further than you've already told yourself you feel comfortable with. And then maybe after a day or two, you might try removing one of the blocks and see if you can go a little bit further. And maybe you can, and maybe that's a great way of measuring progress. And if you decide to take a sustained pose, then just go into this position and do your best to spend a couple of minutes here relaxing. Just deep, slow breathing. Inhale through the nose, exhale through the nose. Try to breathe in for 4 seconds and out for 8 seconds. And sometimes after relaxing, when you come out of the pose, people feel a little twinge, and that will be totally normal and safe. Don't worry. I promise you, you're not damaging anything, even if you feel a little twinge coming out of the movement. I promise. But to come out of the pose, to make it a little bit more comfortable, sort of come up with the chest first here, and you can even come up to the arms second. So now we're really coming out of the pose, and maybe just give a little bend to each side. So we're just kind of working some movement into the back here to kind of turn those muscles on, bring some awareness to the area. And then we could start to come up, or we could even just sit up all the way. So even a common yoga pose with a few modifications can be used to help your low back pain, even in the case that you legitimately have a disc herniation or a bulge or something of that nature. More than anything, this is a safe way for you to explore movement to make sure that your brain predicts that movement is safe, so that you don't over time become afraid of movement, afraid of bending your spine, because that actually leads to more pain and more disability than if you had just moved through a little discomfort in the first place. So remember, motion is lotion, movement is medicine, and it's perfectly safe to use your spine in both directions, even when you have low back pain. Be sure to like and subscribe. Thank you very much. I'll see you in the next episode.